Hey, future respiratory therapist. Today we're going to be talking about different types of shock. So excited to get into this with you. Today we're going to be talking about distributive shock, cardiogenic shock, hypovolemic shock, and obstructive shock. So stay tuned. When we think about shock, we have to think about circulatory failure. Shock can be an irreversible condition. It's life-threatening and critical. So, shock is basically decreased tissue perfusion and decreased oxygen consumption to the vital organs. So, when I think about shock, I think about tissue hypoxia, I think about tachycardia, tachypnea, sepsis. So, just like in sepsis, if you have a infection that becomes life-threatening and you don't catch it in time, it can cause multi-organ failure. And basically what that is there's not enough oxygen getting to those vital organs, so they end up shutting down. This can cause ultimately death. It is irreversible if caught on early enough, but unfortunately that's not always the case. We're kind of going to go into the different types of shock because there's quite a few different types. Like I mentioned in the last slide, there's distributive, hypovolemic, obstructive, cardiogenic, just to kind of see different ways that shock takes place and what kind of effect it can have on the body. So before we get into the different types of shock, I just want to go through some initial stages that happen with shock. So often we see the initial stage of shock where the body is first identifying that it is not getting enough oxygenation, and initially there might not be any signs or symptoms, which is kind of crazy to think about. Our body is, trying to survive, kind of kicks into overdrive, and that's when you see that compensatory stage where the body is trying to compensate. So it increases the heart rate, and oftentimes with this you'll see severely low blood pressure, because if you're not getting enough oxygenation, then your body is not able to pump and perfuse like it's supposed to. So we see that happen. Obviously with this you're going to see an increased heart rate. Heart rate's going to shoot up, respiratory rate's going to shoot up, increased work of breathing obviously, and the body kind of starts to say, okay, what can we do to survive this? And that's when it gets to the progressive stage. So at that point, the skin usually is cold and clammy, because the body's not oxygenating well. It's kind of gone into this state of overload or survival, and it's struggling. And so the last stage is really the irreversible stage, where we see, the organ failure, and this can be brought on by different things, but yeah. So when we're talking about distributive shock, we want to think sepsis. So what is sepsis? Well, sepsis is an infection, oftentimes that initiates as a pneumonia and gets progressively worse bacterially, and it ultimately causes organ dysfunction. It dysregulates the host response to infection, and it's often often results with severe circulatory response, and then cellular and metabolic abnormalities. So this can initially present as a high fever, because the body is under stress and it is trying to fight off this infection. Unfortunately, if the body's unsuccessful in fighting off this infection, oftentimes we'll see a progression, and that'll cause a low body temperature, right? Or some state of hypothermia. And that's the result of the body not being able to fight this infection off, and ultimately progressing into organ failure. So something to look out for. Distributive shock can also be a systemic inflammatory response syndrome, or SIRS. It's a clinical syndrome of strong inflammatory response, and it's usually caused by an infectious or a non-infectious disease. It could also be from like a pancreatitis or burns. It really just depends. And then we also see anaphylactic shock. So think like a bee sting, an allergy. Once again, it's kicking the body into an inflammatory response, right? Or a hyperreactivity. And this causes a cardiovascular collapse, which kind of does a similar thing where it causes as kind of does a similar thing as sepsis, where it causes that respiratory distress, right, due to a bronchospasm, and kind of has the same effect: tachycardia, tachypnea, and the body trying to survive. We can also see neurogenic shock, or endocrine shock even. Neurogenic shock we often see with spinal injury that's above T6. And then endocrine shock, it's often due to some type of underlying endocrine issue. So, yeah. So when we're talking about cardiogenic shock, we want to think about some type of myocardial infarction that is greater than 40% of the overall heart contraction, or end stage heart failure. This can often be seen with patients that had acute MI, and due to this, their heart is pumping inadequately and causing tissue to die in the heart. So hypovolemic shock is a very interesting one because we can see this in a number of ways. When I think about hypovolemic shock, I think about low blood volume. So hypo meaning low, volemic meaning volume. So often we can see this in cases of severe trauma. So you think about a gunshot wound, some type of issue with surgery, or even an intense GI bleed can be the cause of hypovolemic shock. So oftentimes some signs and symptoms to look out for. You want to make sure that your patient does not have a very low blood pressure. Anything less than 80 systolic is cause for concern. You want to make sure that their urinary output is not decreased. So 20 to 40 milliliters per hour is considered normal, right? Or okay. Think less than 30 may be cause for some type of issue. And then lastly, we want to look at central venous pressure. So 2 to 6 millimeters of mercury is a normal venous pressure, right? As we know. So less than 2 is cause for concern or is the result of hypovolemic shock. Okay, so this is the last one we're going to briefly go over. So when you think obstructive shock, think obstruction. So obstructive shock is very similar, in my opinion, to cardiogenic shock. It's a lack of proper pump. It's like a failure for the heart to pump, or the result of pump failure due to decreased cardiac output. So basically, if we're talking about like a tension pneumothorax, right? Think JVD, low BP, and decreased sound activity. So we want to remember that this is going to cause a decreased blood flow from the right to the left heart. Very similar to like cardiac shunting, but without proper blood flow, right? It's going to create an oxygenation issue. And just like we've seen in the other types of shock, the result is going to often be the same. So I threw this last slide in here because there's always other reasons, there's always other things that we're learning about, or the medical community is learning about, that are the result of shock, right? So there's other metabolic processes or other reasons that shock can happen that don't always fall into these categories or types that we've gone over. So I just wanted to include this slide in there And then my last slide is my reference page. I mainly got my references from the website that was provided. But then I also used the comprehensive textbook that was very helpful in kind of breaking down the definition, the causes, and the signs and symptoms.